Good morning, everyone. I'd firstly just like to, of course, acknowledge the traditional owners of the land on which we meet and pay my respects to elders past and present. Good morning and welcome to you all. And I realise that this is a rather competitive time slot, so we feel quite honoured that you're actually here and rather under pressure to perform, but we will do our best. What we're here today is to talk about really the value of partnership research in increasing the use of evidence in research and policy. And we're using the Australian Prevention Partnership Centre as a case study for that. So just a quick acknowledgement of the funding partners of the Australian Prevention Partnership Centre, and I'll tell you a little bit more about who we are and what we do in a minute. The way we've structured today as a little bit of a presentation and then some input from our panel. So I might introduce them first, get those kind of formalities out of the way, and then allow us to do the presentations. So let me please introduce then our speakers. To my immediate left is Dr. Sam Rowbotham. Sam is a research fellow with the Prevention Centre, and she's based at Menzies Centre for Health at Sydney University. She has a background in psychology with a strong interest in health-related research. To her immediate left is Professor Billie Giles-Corti. Billie is at the urban... I'll have to read this one out because it's quite long, Billie, so I didn't even attempt to remember it. Billie is the Urban Futures Enabling Capability Platform Director at RMIT University and an honorary professorial fellow at the University of Melbourne. So Billie has several decades of working with a multidisciplinary team of researchers and postgraduate research students studying the impact of the built environment. Billie is an NHMRC Senior Principal Research Fellow, an Honorary Fellow of both the Planning Institute Australia and the Public Health Association, and in 2008 was a Fulbright Senior Scholar. Professor Adrian Bauman, in the middle of our panel, is a sesquicentenary Professor of Public Health and Director of the Prevention Research Collaboration at the University of Sydney. He has academic expertise in all aspects of the primary prevention of chronic disease, with an emphasis on physical activity, epidemiology, population-level interventions, and policy research. Adrian is lead of the Rapid Response Evaluation Capacity of the Australian Prevention Partnership Centre. To Adrian's left, we have Dr. Jo Mitchell. Welcome, Jo. Jo is the Director of the Centre for Population Health in New South Wales Health, and in this role she is responsible for leading the development, implementation and evaluation of health promotion policy and strategy at the state level. Jo has a postgraduate diploma in nutrition and dietetics. I can't even say that. Dietetics sounds very impressive. A Master of Public Health from the University of Sydney and a doctorate in Public Health from Flinders University. And last but not least, Paul Kelly. Dr. Paul Kelly is on the end of our panel here. Paul is a public health physician, epidemiologist and health service executive. He's currently the Chief Health Officer for the ACT and Deputy Director General of Population Health in the ACT Government Health Directorate. He is also an Honorary Professor at the ANU Medical School and also a member of the Australian Health Protection Principal Committee and the NHMRC Council. Now, formalities over. Wonderful, stellar crew that are going to help us talk today about partnership research. And just really the way we've got an hour and a half together, I don't know how engaged you'll all be, but we're hoping there'll be so much conversation, we'll just keep going for that period of time. The way we've structured it is that I'm going to briefly just introduce why we're here as a centre and how we operate in terms of facilitating partnership research. I'm going to hand over to Sam to talk a little bit about our evaluation and what we've learnt so far when we reflect back on the time that we've had so far. Then I'm going to hand over to the panel, and we've posed each of them the same 3 questions to feedback from their perspective how working in partnership has or hasn't worked for them. And then, of course, hopefully we're hoping that there'll be lots of time at the end for you to ask us questions, give us your ideas, any insights, and to challenge us on this model of research. So that's how we're going to run the day. I'm really hoping this will be really interactive, so if there's something that just doesn't make sense, please raise your hand and we'll stop and do our best to try and bring people together. So, just by way of introduction, I've just got a few slides here about why we're here and how we're operating. The first, and I don't need to probably really emphasise this point significantly, is that we all know that evidence is really valued and really critical to good policy and good practice. But of course, there's often a gap in terms of I've just made up a new word. It's probably an evidence research gap. Anyhow, a gap between the creation of this evidence and its use. Lots of different reasons, and today is not to go through and debate all the different reasons why that occurs, but suffice it to say, there's just a lot of issues around timeliness, relevance of research and how it can and can't be used to influence policy and practice. Recognising those challenges, though, there is an increasing amount of evidence that cross-sectoral, multidisciplinary partnership research is a really critical way of effectively encouraging the use of research in policy and practice. And I emphasise here that I think that's especially the case when the issues being addressed are complex. So from my perspective, my focus is on the prevention of lifestyle-related chronic diseases, which I don't think I need to convince the group here are an incredibly complex situation. So being able to have multi-sectorial, cross-disciplinary people coming with different views of the world to come together and try and unpack and better understand that problem is the way that we're focusing our research. And I did like this quote that I won't read out, but at the bottom of that slide, just from a publication in 2007, just really emphasising that, you know, we're trying to move away from that kind of linear, I will do something, it will be wonderful, you will pick it up and use it, to something that's more of a co-creation joint effort. The NHMRC has established partnership centres for better health. The aim of these centres is to tackle the most complex public health problems. They are large-scale national policy, practice, research collaborations. Each of the centres, I've said there is actually now 3 in existence. We were established in June 2013. The first, with a focus on cognitive decline, was established 6 months before us, and the third, with a focus on health system sustainability, was established just a few months ago. So we now have 3 of these initiatives. They each have their own theme, but are really established around a common set of objectives. And I've listed them here around collaboration, evidence synthesis, dissemination, implementation, and capacity building. So I would pause there and say I actually think this is a really bold initiative from NHMRC, a real significant commitment to this model of research that is quite new. Other countries are going this way, and I think that we're all sort of, our initial reactions is that things are positive. Mind you, that's part of what today is about, to get these guys' input, so I might be slightly biased, and I'll admit that. So the Australian Prevention Partnership Centre, we're being the second of those 3 partnership centres. Who we are administered by the Sachs Institute. Our work is co-produced by researchers, health system practitioners and policymakers. And our purpose of being is really to identify new systemic approaches to improve the prevention of chronic disease. It's a national collaboration. Currently there's about 150 different individuals involved in the centre. I'm based at the Sachs Institute. I'm Deputy Director of the centre. And at the Sachs Institute we have the coordinating centre who really try and bring this group of people together. At the outset, our centre was the funding partners and the academics who came on board agreed a broad work plan that would see us nice and busy for the next 5 years. Some 37 projects are now underway across the collaboration. which is great. It means things are really busy, lots happening. But the key really to what we're doing is really trying to bring those 37 projects together into a collective whole that is greater than the sum of the parts. So this, I think it is a tad blurry, but suffice it to say it's a wonderful image and I can give it to you in a non-blurry way, just to talk a little bit about how we work. So we've got all these people across all states and territories, and we are working with every state and territory health department as well as the Australian Government Department of Health. We have tried our best to try and bring in non-health sector, and I think that that has been trickier than we probably anticipated, with lots of staff movement. I think it's in our next phase, I think for me personally, that will be a big focus. But for now, in terms of our structure and our governance, we have 3 entities that really drive our leadership in governance. One of those is our governance authority. So the governance authority is the funding partners, and I listed them in the initial acknowledgement slide. So the funding partners are NHMRC, New South Wales Health, ACT Health, HCF, a private health insurer, and also the Commonwealth Department of Health. So that group meet at least 4 times a year to really have input and, I say approval to the budget, but it's not or to me certainly it doesn't feel like I can't think of the right word. I was going to say servant, and that doesn't seem quite appropriate, but it's a very collaborative engagement around what are the priorities, how should we focus the research. So that's the governance authority. We also have a leadership executive. There's 7 people in that, including a director, Andrew Wilson, who's probably known to many of you, and also myself as deputy director, and another 5 chief investigators and funding partners who come together regularly to really be stewards of the dollars and the deliverables and the accountability of the program of work. And we also have an International Scientific Advisory Committee, and Diane Finegood is here somewhere, who many of you have heard speak. Diane's a member of a very small but a very elite group of people who we connect with a couple of times a year to really give us confidence that the science of what we're doing is good and that it is good value for our partners. In terms of actually keeping this initiative alive, a very key part of that is a coordinating centre that I mentioned briefly. There's about 6 people in that group who sit at the Sachs Institute, do a number of things, but mainly lots about getting the projects up and running, making sure the budgets are all in line and that people are delivering. Some of our panel might say, I think the kind of accountability and reporting is a little bit more intense than a more traditional NHMRC funding. I actually think that's okay. We want to show as a centre that we're doing something that's big and good and that our partners are getting a return on their investment. We also have, of course, standing capacities. We've established these 4 kind of units of expertise, hubs of expertise, one around a rapid response evaluation that Adrian leads. We have a synthesis capacity, which looks at doing more traditional reviews of evidence, but also we've innovated in that space, and now a key service in that area is around dynamic simulation modelling and bringing in experience as well as research data into better understanding problems. We have a communications and valuing prevention capacity, which is a really, these are kind of not necessarily blocks of people, but they're just concentrations of expertise around different needs of different people. And I'm missing my 4th one. Oh, the system science and implementation capacity, which is based at La Trobe University with Alan Scheel, with a focus on really increasing capacity around system science and a lot of work around network analysis. So that's sort of a hub of people. And finally, the last kind of layer in that inner circle of cogs is really the project teams. So they're everywhere across the country. Slightly, at times it does feel a tad like herding cattle, but everyone's out there, everyone's engaged, wearing multiple hats, but one of our challenges is really trying to bring people together into this whole. So that's structurally how we operate. In that image that you've got there, we've got those cogs in the centre, which I think are really like the backbone, the hub, the thing that just keeps us functioning. And we're saying that those are leading to the 6 elements that are in the dark grey aspect of that diagram, which are really what we're seeing as what our partnership strategies are. What are we doing to facilitate that partnership with the ultimate aim of achieving the outer circle of that image, which is around really developing new knowledge and methods, making available policy relevant advice, and ultimately, of course, being able to influence decision making. So what I'm just going to do, I'm going to whip through this next bit just quickly because I think we'd rather get on to hearing other people's perspectives. But what I've just done now is really just listed our strategies for partnership research. So we're very fortunate. We've been given a decent amount of money. It's $22.6 million over a 5-year period. And that includes in-kind as well, and that's actually an increasing amount of in-kind. And when I say in-kind, I mean people like Joe and Paul who actually give up a lot of their time. And you guys don't get counted, I don't think. You just do it for the love of it. But the academics just do it for the love of it.
Oh, yeah, we love it.
They just do it for the love of it. But somehow we managed to get time in the busy schedules of people like Joe and Paul who really are critical to our programs. So there's a decent amount of money, but with that, it means that we are able to deliver on these strategies that we think make the partnership what it is. So I'm just going to run through them quickly. I'd rather talk more about them later with you if you'd rather. So in terms of partnerships, that strategy, I mean, there's a lot around there around, I've listed it at the bottom, but the 5 years of funding, and we're really hoping that that will increase to a longer term funding. We really do need that time to establish the relationships and the trust between the academic researchers and the system-based researchers. And we've created opportunities for many opportunities for exchange and repeated interaction so people get to know each other, understand where each other are coming from. I've listed their knowledge co-production. We actually make it a prerequisite from all of our projects that funding is only made available if the project team can demonstrate that they are a mixed group, so that it's not just the academics driving the research, it's not just policy driving the research. We want people to come together as a collective to come up with the research questions, implement and communicate. So people do that at varying levels, and I completely take that and I understand that, but it certainly is something we're trying to encourage people to do. I've noted there too a flexible work plan. So I think I did say at the outset there was a work program agreed between the funding partners and us as the recipients of the funding, which was great. But what we've been able to, we've been given the permission and flexibility to adapt that to changing needs. So that's done in partnership with our partners, a conversation. Project X that looked like a good idea 3 years ago, not quite certain it's a good idea now. Why don't we refocus? And that's been very well accepted, which has been great. Knowledge integration. So this is a key aspect of what we do. So we really don't want us to be just 37 separate projects. There's common themes. There's learning that can influence each other and come together. So we have designated roles of a learning and development manager and also a communications team, which is now about 2.5 full-time people, which is just luxury if you're been in an academic environment to have access to skilled communications people who can help you with your messaging and deciphering of the complexity of what you're doing. So it's a great asset, I think, and has been made available through the model. Just briefly around engagement, obviously resourcing is significant. I think the co-funding is actually really critical as well. So there's skin in the game. So we've got NHMRC, the dollars provided by NHMRC have been matched by our funding partners. So they've got skin in the game from the outset. So they want to make sure they get something in return for that. So, and that's okay. I think that's appropriate. That really encourages the research to be relevant. Just quickly then, capacity and skills we see as a really essential element of what we do. And again, we've got our learning and development manager, who's a 0.6 position. We also have a full-time manager of systems thinking and capacity building. So again, a lot about targeted skills training for our researchers, but also try and encourage them to do policy and practice research, relevant research, but also trying to upskill people working in policy about how to access and use research. We've been fortunate enough that we've been able to make available scholarships, PhD and master level, And we've also set up a research network, which I personally am very proud of, and I think it works really well. So we have a number of very, very busy, very senior academics who lead the partnership, but it's that kind of next layer down of the early to mid-career researchers who, and can say, I think from personal experience, you kind of can bounce around an academic institution trying to find a mentor and support. So we've created a structure for that. This group, there's probably about 45, 50 of them, come together face-to-face as much as we can afford, but we really encourage them to try and talk to each other and get support from each other. So that's been a really nice advantage of having this sort of critical mass that we can bring that group together. The last thing I just wanted to mention was adaptive learning and improvement. So we do have a comprehensive evaluation framework, and it's really coming together really nicely, and it's really looking at ultimately what we're trying to do is improve the prevention of chronic disease, but we're also testing this model of partnership research. So the evaluation framework has been set up in a way that we're hoping that we can unpack and better understand the model and what is and isn't working. So that's sort of on a big level, but also on a day-to-day basis. We get feedback, formal and informal, when we ask for it, when we don't ask for it. We get this feedback and we do our best to try and adapt and be as responsive as we can as an evolving institution. So that's me, just a bit about us. I might pass on to Sam just to give you a bit about reflections, and then we'll see if there's any points for clarification.
Okay, so as Sonia's mentioned, we've got a really comprehensive evaluation framework, and we've developed it drawing on learnings from developmental evaluation and contribution analysis. So the actual framework consists of a range of different evaluation questions. So some of them are kind of broad, overarching questions about how we're functioning as a partnership centre as a whole, how we're doing things like integrating systems thinking into our work, how the partnership centre as a whole is being implemented and what we think we're achieving from that. And then we also have specific evaluation questions directed at the various domains that Sonia's just introduced to you. So we've got questions around what activities and strategies are being implemented across the centre. So from those hubs of activity that Sonia described, like our coordinating centre, our standing capacities. And then we've got questions around the specific domains, so knowledge co-production, capacity and skills and so on, and then around our longer term outcomes, around new knowledge and methods, implementable policy relevant advice, etc. So we're trying to look at not only what we're doing and what we're achieving, but also how what we're doing contributes to what we're achieving. So we're trying to map out what it is that works, what doesn't work so well, and what we can do to improve, both within the life of this centre and going forward, and to share that learning beyond our partnership centre. And we do that using a whole range of different data collection methods. So as Sonia just mentioned, some of them are more immediate and responding to kind of feedback that's coming in on a day-to-day basis. Others are more formal evaluation activities that are scheduled for particular times throughout the life of the partnership. And as you can see there's a whole range of methods. So using things like key performance interviews, social network analysis, using key informant interviews. So a really comprehensive set of data sources to help us really evaluate our centre in detail. So one of those that I'd just like to touch on briefly is our partnership survey. So this is a survey that will be done 3 times, I think, over the life of the partnership centre. So the first one, the baseline was June 2015, and the follow-up was September 2016, and we'll do one again early next year. And this partnership survey is really led by Dr. Anger Insight, who sits within the rapid response evaluation capacity with Adrian. So the results of the kind of first 2 are in, and it's allowed us to see how we've improved over that period. So it's a really quite a comprehensive survey, assesses a variety of domains of partnership research, and it's really about trying to see how the partnership and the process and the engagement in the partnership is tracking over time, and to really identify areas for improvement. So these are just some top line results from that survey. So as you can see, there's 5 kind of main domains, and these are composite scores across those domains. So the first 4, leadership, governance, resource allocation and collaboration, they're scored out of 35. And the final domain of staff engagement is scored out of 49. So you can see from the dark green and the light green bars that we've improved across all of those domains across the 2 periods of time. And our biggest improvement looks like it's around staff engagement with the Partnership Centre. And that's notable because after the first partnership survey and the first round of key informant interviews that followed quite shortly after that, we implemented a number of actions to really improve engagement with the centre and attend to making sure that people can engage and feel engaged with the work that we're doing across our broad network. So there's a lot more detail within this actual partnership survey, and I'm happy to talk to that later if needs be. But what I'd like to do now is just provide some kind of broader reflections on our experience as a whole across the different domains that Sonia introduced. And really focusing on those ones on the inner grey circle, so things like partnerships and knowledge co-production, because they're really about our processes and our strategies and where the learning is about how we're doing as a centre as a whole, and we hope that they will then contribute to our actual outcomes. So in terms of partnership research, we found that personal relationships are particularly important in this kind of partnership, and those personal relationships, particularly pre-existing relationships between academics and policymakers and practitioners, were really, really key to getting things off the ground and allowing work to happen and enabling the successes that we've had so far as a centre. One challenge that's been identified is kind of going beyond those personal relationships sometimes and having a deeper embedding within the organisations that we're working with. So a challenge has been that if someone moves out of a role within a government department, it can be difficult then to carry on that relationship because a lot of them are personally based. So that's something that we're working on and trying to kind of find out how we can embed those partnerships more deeply. In terms of knowledge co-production, people really have valued knowledge co-production and see it as being really important to ensuring their research is relevant, but have also identified it as challenging. So for both academics and policymakers, it represents, for some, a different way of working. So for others, it's a way that they've been working for a very long time. For some, it's much newer. And there are challenges on both sides. People work in different contexts with different time constraints and different cultures of working. And one challenge there has been around moving from more contractual and commissioned relationships between researchers and government departments to a more true co-production mode where they develop the research questions and things together. But one thing that we've identified is that actually having a mix of both of those things might be beneficial. So to ensure that we're meeting needs of funders as well as the research programmes, is to have a mix of those things. And our system dynamic modelling is an example of a kind of really successful example of knowledge co-production where policymakers and researchers were engaged together right from the beginning to develop systems dynamic models, and a number of those have now been developed, and Jo might talk more to that later. In terms of knowledge integration, this is something that has been challenging. There's a lot of projects across the centre, and in the key informant interviews that we undertook last year, we found that there was a sense sometimes that people didn't quite see how they all fitted together. So that's something where we've put a lot of work to starting to pull things together and be able to tell the story across projects as well as within projects. So we've got a number of really great knowledge integration products, and we've had some really good feedback around those. So kind of getting the knowledge out there in ways that are accessible. Engagement as well can be challenging again because of the size of the centre. So we've got fantastic investigators across the centre in both academic and policy environments who are really truly engaged with the work of the centre. But in terms of the practical realities, people are geographically dispersed, they've got other commitments, they've got their own centres of excellence and their own postdocs to support and so on. So that was identified as a challenge to remain engaged while also dealing with those pressures. And that resourcing is really key to that engagement. So the fact that we provide funding for projects, provide support in terms of the coordinating centre, supports with administration, travel bookings, reporting, all of those kinds of things was really key to helping people remain engaged. And the strategic communication was valued here too. And then capacity and skills, as Sonia's mentioned, we've had a whole range of events, and we've had some really good feedback around those events, and people have identified specific skills and feel that they're getting skills as well as their network building. Those things have been valued from the various events. And then finally, our adaptive learning and improvement, as Sonia's mentioned, has really allowed us to attend to kind of how we're going as a centre and to change course where needed and to adapt over time. So that approach has been really valuable, while still also being, challenging to maintain that cycle of continuous data collection and learning from that. So I'm going to hand back to Sonia now to just take questions at this point before we hand over to the speakers. Thank you.
Okay, we might then just move on to our panel, and of course you can ask questions later. So in terms of the panel, we've posed them these 3 questions. There's probably more, but we thought we'd keep it polite, and they're all going to behave and be as nice as possible, but we do want them to be honest. So, I'll open it to them, and then at the end, if there's any other questions, we can ask them as well. So if for no other reason, I might go in the order you're sitting. Is that all right, Billie?
Oh, sure. Yeah, I saw it was here. I was going
or would you start at the other end?
I'm ready.
You're ready? Do you want to come over here then? Because then you've got the mic, and then
all right.
we'll swap over.
I've got a mic here, but anyway, I'm happy to stand. Okay, so my role in the Partnership Centre is to be responsible for the non-health sector. And as Sonia said, I'm now the Urban Futures Enabling Capability Platform Director at RMIT. And my job is to enable the capability of the university to solve complex urban problems. And that reflects the work that I was meant to be doing with TAPS, is that not to be talking so much to the health sector, although the health sector is involved in my project, which is developing a national livability index or indicators. But it was really the job was to try and work with the non-health sector. So in some ways that's been somewhat easy because I have a Centre for Research Excellence, and there's been this, we've had significant funding from TAPS, but actually the work has involved much more funding because we've been able to cobble together the other work that we're doing. So we have a Centre for Research Excellence, and that has in each state that we're working, in Western Australia and Victoria and Queensland, policy advisory groups that were made up of the non-health sector as well as the health sector. So it sort of made it a bit easier. So with TAPS, what we were able to do though was to bring in the Commonwealth. And so, but just to give you a sense, working with the Commonwealth non-health sector, that would be around cities, which is really where this work sits. We've had 4 departments, we've had 4 ministers, we've had many more changes in personnel, and we've had 4 prime ministers. And that's actually really important because when we changed to a Liberal government, we first had Tony Abbott. He wasn't interested in all in cities, and now we've got Malcolm Turnbull, who is interested in cities, but we're not really sure whether he'll survive in the long term. So there's all this sort of, ambivalence about what we're doing in a sense. So it's been a really big challenge. Now, where did the partners get involved? At the very beginning, we got them involved in talking about how should we shape our projects. So we've been defining livability through a health lens, and so we wanted to, but this with the TAPS, they're particularly interested in chronic disease. So we were interested in indicators around walkability, around transport, around public open space, in our broader livability work around employment, social infrastructure. But what we did for TAPS, we added in the food environment, access to healthy food and access to alcohol. And that's quite important because actually planners don't have much of a focus on distributed where food outlets should be or around alcohol, funnily enough. That's been a major finding that we've done. We've discovered that there is very little planning policy around those areas. But at the very beginning of the project, what people said to us is that we should make sure that the project is policy relevant, so develop indicators related to our indicators of livability, make it policy relevant. So that was really important. So we changed the project immediately. We did a policy analysis in each of the states around each of our indicators. So they really did influence what we did. And what we did find, as I said, one of the major findings is that there was so little policy around food and alcohol in planning policy. So when we're doing research, I mean, I've been wondering for a while, how do we get research translation? So what do we need to do as researchers? And we've come up with the key things: interdisciplinary research teams, because we don't know everything about the sectors that we're trying to influence, and then involving policymakers and practitioners, answering policy relevant questions, understanding the policy world, which is why we did the policy analysis, which was so important, using study designs that are policy relevant, adopting dissemination strategies with knowledge brokers, advocates and lobbyists. And it'd be fantastic having the TAPs working with us, because they've really been able to amplify our findings. Providing training for researchers and having different reward systems. So we've looked at the literature, and that's what we have to do as researchers. But actually what I've discovered doing this work in particular, that I think, and it's came up in the evaluation, there needs to be something on the other side in terms of the partners. Now, I think what we've been trying to do is work with policymakers who aren't really interested in health, and I think we've stepped very tentatively in doing that, engaging them, and we've had long-term relationships. But our CRE advisory groups now are quite on board with what we're doing. But with the federal department, they were a new group of policymakers, so we weren't going to ask them to write an MOU when we started, so we didn't have a formal relationship. And I think that has been a major problem. It related to the fact that there was a personal relationship with the people we were dealing with, fantastic people at the beginning, pretty good people next stage, and then it's really hard to keep up with that, particularly because it was in Canberra, having to go to Canberra and keep that relationship going, particularly because they actually didn't know what was happening either. With all the changes going at the federal level, they're also not sure about it, and they're also very worried about their ministers and making sure that they're doing what the ministers want. So it's actually, I think that whole idea where we could have improved is to have a formal relationship. I think with partners, I mean, I've looked at the literature on this because I'm trying to understand how do you I've looked at what we need to do as researchers, but what do the partners need to do? And one of the things the literature says is that they need to be aware of the pressures that we're under as well. I mean, that we're trying to beg them to be involved with us and to do things that are relevant. But people need, so that we can have this mutual respect about the pressures we're under as well as what they're under. And we need to be, as researchers, making sure that we're interested in the validity of research, but we have to make sure that it's relevant. So we have to change what we do, but they sort of need to understand. So it needs to be this two-way communication, is what the literature says. That's because it's the personal relationships that determine what we get to know about the world, the policy world. If we don't have a good relationship and it's not a two-way relationship, they're the ones that can tell us what is important, so that we can have more effective insights into the policy world. The other thing that I looked at in the literature was, it's interesting when people are asked, policymakers are asked, who do they trust as experts? And what they say is that the academics that people regard as trustworthy, and that's really important if you're going to sort of share what's going on in the policy world, are those who've got competence, integrity and benevolence. And when they're talking about benevolence, what they talk about is the commitment to the policy reform agenda, the ability to when there's an ugly compromise about what the policy ends up with, not to go into the media and bag them, but actually to be supportive when they've sort of made some progress. And it's so easy to sort of be critical, but it's very hard in that policy process to get what they want and what you want. So I think that's been interesting. I think that there's another side to it, and I think that those things equally apply to there's not research on this, what makes a good policymaker to work with. And I think the same thing applies. A good policymaker to work with is competent, has integrity and benevolent. And I guess benevolent to the stresses that we're under as researchers about the pressures that we've got to still publish but still engage, to keeping us informed so that we know what's going on. So I think there's two sides to the coin that will actually help produce this better relationship between policymakers, practitioners and academics. I've probably done my time, have I? Can I keep going? Oh, goodness. Okay, have I answered all the questions? Okay, I think I've covered the main points. So I think that in terms of what needs to happen, I think more formal commitments. And I think that maybe you can't do that at the very beginning. I think when you start out these things, I think it comes, once you've had the relationship, then move towards a long-term commitment. And as I said, what I found with the CRE, we have got now these long-term commitments and we are able to get to the next stage because it is a relationship. It's a relationship with the organisation and it's your credibility. I think we have to be policy relevant as researchers. We're not going to get any influence at all. I was at a very interesting meeting with Don Nutbeam and John Hyde from Victoria and someone who had worked with Whitlam government, and what they said was really disturbing to me, that so much research is completely irrelevant to them. Even commission research done by academics is so irrelevant, and so we are so afraid, or we don't know what to do. We can't actually provide advice about that, which I thought was really disturbing for us as academics. I think the only way that you can get insights into understanding what's a good policy or what's potential is the relationship. And I don't think we should have all the answers, but if you're working closely with policymakers, you can share the results with them and you can work together and say, well, what could we do? And then your recommendations could include insights from the policymakers that you're working with. So I think that's really critically important. I think we have to think about very carefully as academics about the ways that we communicate our results. You know, it's been so fantastic having the TAPS team, Marge and others, to help us to communicate those findings in ways that's relevant. I think the other thing that I've discovered is, and it's time consuming, it has to be funded, is it's really, you have to be available, you have to be responsive, and you have to turn up to all the events that they organise, others organise, our policymaker colleagues. And that means I go to things on transport, on planning, on all sorts of things that are outside of health, but you know, you have influence because you turn up and then you get to know people and you build not just a relationship with one people, but a range of different people who are in the sectors that we're trying to influence. So I think they're the sorts of things that we need to be thinking about. Thank you.
Thank you. Okay. Thanks, Billie.
Good morning. I've had a long history in program evaluation in public health and health promotion and complex program evaluation, and some of the work that I've done has led me to be in charge of the rapid response evaluation capacity of TAPS, and I'm going to talk about that in terms of partnerships. But I'm going to define it in terms of 7 types of error that we could make. How many people here have heard of type 1 and type 2 error in statistics? In other words, detecting effects that don't exist and failing to detect effects when they do exist. I'm going to give you 5 more, but not as errors, more as learnings. That's what we call them in evaluation. Type 3A error is making partnerships that don't exist or cease to exist once you've started to make them. And when we were forming as the Prevention Partnership Centre, we formed very good research partnerships with ANFA, the Australian National Preventive Health Agency, and with evaluating a suite of projects organised by primary care units known as Medicare Locals in 5 states and territories across Australia. As we formed, those things, politics changed, governments changed, and those entities ceased to exist. So we were left having developed a whole bunch of evaluation capacity in things that were no longer there. So that's type 3A. Type 3B is not making partnerships that should exist. And one of the challenges we've had is cross-sectoral partnerships. Working in prevention means we're working outside of the health sector with much of what we do. And cross-sectorally has been difficult to work in through the Partnership Centre. Even making partnerships with all jurisdictions in Australia has been difficult because we've been funded only by a few of them. Those are challenges, and we need to make those partnerships work better in the way that Billie has done well with transport and urban planning specifically across other sectors and agencies. Type 4 error, or type 4 learning, is making partnerships that aren't partnerships. And that is really, it's very difficult to make a partnership. A good partnership takes a long time of developing trust, reciprocity, mutual respect of understanding of the values of the researcher and the academic and the policymaker, and then working in co-production from that position. So when you're a new on the block prevention partnership centre, it's difficult to form those partnerships instantly. It doesn't just happen. You don't just add water, come to a partnership meeting and we'll all be partners. It doesn't happen that way. And that means that the TAP-C idea is a long-term investment in developing evaluation capacity for prevention across agencies and jurisdictions, ideally in the long term. Type 5 error is really evaluability. Somebody comes to you with an evaluation idea for a program that's already started, and the program's not really ready to be evaluated. And that's where the reciprocity and mutual respect come into play, because if we advise, well, you shouldn't really be doing that, and there are pressures to do that on the other side, it becomes a complex task. Type 6 error is the error committed by most researchers, many in academia, which is not understanding the policymaker's context. And as Diane Finegood says so eloquently, policymakers work at two speeds: the speed of light and glacially. And researchers work at neither of those speeds, ever. So you actually have to develop a way of being responsive in absolute real time. When they say they want an evidence-based review by Monday week, they mean really by a couple of days before that, if possible. And just because you say it'll take 4 months to do, that's not a way in which the partnership's going to thrive. You've got to understand the pressures on policymakers. The kinds of evidence they need are not necessarily, or are a subset, or are a reinterpretation of the evidence that we present academically. So those are some differences in understanding context as part of that shared agenda in order to have co-production. And finally, type 7 error, or type 7 learning, which is the one thing that surprised me in the Prevention Partnership Centre. We were developed as a rapid response evaluation capacity. So we're like, like rapid response evaluation rangers. They're in our ranger suit, ready to slide down our fireman's poles and go out and solve evaluation problems in the real world. But so far, we haven't had any rapid requests. Now, it doesn't mean we're still sitting around waiting for something to happen, because we've been involved in a lot of more complex evaluation thinking. But the rapid response, we're about to develop a policy in X, or we're about to implement something in a particular jurisdiction, or we're about to do something relevant to prevention. How do we evaluate that? That's an important kind of a question that won't be funded anywhere else. The evaluation capacity for that won't come out of traditional NH and MRC types of funding or other funding. So this is a new model for doing that kind of work. And that's an important dimension that I think the rapid response evaluation capacity could still do. We won't work at the speed of light, but we will work rapidly. Thank you.
Okay, so I love that, glacial or the speed of light. Welcome to my world. Sorry, I'm just getting my notes up. So I'm a policymaker and I work within a bureaucracy. And we've been involved in this partnership centre since the beginning, and we actually fund $2.5 million worth of skin, which goes into the centre. And so that's a lot of money for us, and so it is a significant investment. And so our involvement, well, I have personal involvement. I'm involved in some 5 projects. My team are involved in probably up to another 5 projects. Our Office of Preventive Health, which is part of our family, are also involved in other projects, and my colleagues in the Centre for Epi and Evidence are involved in yet other projects as well. So we've got a lot of involvement, it's very clear to say. And my sense is that the projects that I've been involved in, they're different. They also have different impacts. So one is, in fact, a modelling project, which I'll talk a little bit about later. So this modelling project has helped to inform what we're doing in our childhood overweight and obesity work to meet our New South Wales Premier's target for us there. And so we use that, and we will continue to use it again and again and again. Other projects have come from really surprising places. So, for example, we have an IT system which we built to help us to implement projects at scale across New South Wales. And when we presented it one day to some of the academics in TAPC, they got really excited, and we didn't quite know why. So we're now looking at a project, well, we're involved in a project with them, and the interesting thing about this project is that it's actually quite philosophical for us about, well, how do we measure the work that we do, and that's important because we're system managers and we need to see progress in some of our statewide programs. But it's also made us stop to think about the way in which we measure influences how we do the work as well. And so what are the positives and negatives of that in terms of quality practice for our programs? So the work that we're involved in is relevant to us, some more than others, and in ways that we couldn't really anticipate. And on a really personal level, there's that question about, you know, the time that you put in, and it is a lot of time that we are involved in this work. But one of the really great things which I didn't anticipate was that sort of sense of input and excitement that you get from being involved in such projects where you, well, for me, where I get my head away from the everyday policy work and start to think much more broadly about prevention and the endeavour that we're collectively on, and how this work actually contributes to building credibility for prevention as well. So it's engaging and energising as well. What works for us is being involved at an early stage. That's important, but the other side of that is that the policy window needs to be open. So now I'll talk about some of the modelling work. We were approached to be involved in an alcohol modelling project, system dynamics modelling. Looked really interesting. Our centre had just taken on responsibility for prevention of alcohol-related harm, so it looked like a good way of, you know, learning about the field, but also in a really innovative way. It was great. It was really exciting. We did a lot of collaborative work with our clinicians as well as academics. We built the model, and that's kind of where it stopped for us. Not because it's a good thing, but I think I've just learnt that we had type 3B error, which that we were the health system policy partners, but we hadn't actually involved the other part of our bureaucracy, well, not our bureaucracy, but government bureaucracy that looks after alcohol policy, for example. So the big levers around alcohol. And so that was an error for us because, you know, our interest was about what the health system could do, but it transgressed that into bigger questions. However, with the overweight and obesity modelling, that's much more useful for us because we have got the imprimatur from government to be looking at what are some of the broader things that we need to do. So we need to be involved, but then also there needs to be the right conditions, I suppose, for us to be able to take on those learnings in a very meaningful way. I agree that that a researcher's priority and a policymaker's priority don't often align, and I'm still smarting from a particular occasion where I was at a partnership meeting and made a comment about, from a government perspective, X, Y, and Z, and was told by a researcher, well, that's just the wrong question. You know, that's not the right question to be asking. You need to be asking this instead. But it was very much from the perspective of dismissing what is our reality in working with government about the government of the day and putting those policies into place as well. And so I think that is actually about that sort of understanding of the different roles that we all play, and that for us, research can be really useful lever in terms of change, but it's also about incrementalism for us as well, about putting known things into practice and doing them much more broadly as well. So I think that is that there are just times when our interests don't align, and we just need to acknowledge that that's not the case. So I think finally what I'll say, because I think I've got about a minute left, is that enduring relationships and trust are important. And I think one of the benefits for us in New South Wales with the centre is that with some of the researchers, we've had those long-term relationships. And so we've had those opportunities to understand each other and get to know each other, which has been very positive. But one of the very exciting things about the centre too is that it's actually opened up the doors for us to meet new researchers who have different ways of thinking. And so I now find that there's a broader range of research experts that I can call up in a way that I've not been able to do before, and ask for the really rapid advice. But again, I think it's the not underestimating the time that it takes, but also the trust, the mutual trust and respect to be able to take advantage of those relationships as well.
Okay, thank you. So I'll touch on some of the things that others have said, but then try to add to my own perspective. So I'd like to acknowledge the land on which we're giving this talk today, the land of the Wurundjeri people of the Kulin Nation and their elders past and present, and any Aboriginal and Torres Strait Islanders that happen to be in the room, welcome. I'm a policymaker, but I have an academic background. I think that's one of the key things that I've taken from the centre, and others have already talked about it, is that change that we need to have in these partnership ideas, which is not about knowledge translation, and this has been touched on before. It's not about bright, shiny ideas that researchers come up with in their own academic setting and then sell to government. And that's not what this partnership centre is about. This is about knowledge. This is a new way. It's about knowledge brokerage. Is what one of the terms that's been used for this sort of thing, and it relies on people that can actually put a foot in both camps. I feel I'm one of those, and the people on this panel are also all four of us. That's something that we really share. And Sonia and Andrew as well from the centre, and others. But that's been a crucial component of it. I think people that have worked in government and understand how government works, or have worked as researchers very closely with government in partnerships before. I think that's been one of the key things. And it's been mentioned before, you just can't add water and have a partnership. So it's that. I've been at this involved with this process from the very first meeting. There was the NHMRC brought out a guy from Canada who'd been involved in this type of arrangement before in Canada, and I went to the first meeting, and it was really exciting and fascinating what was being proposed. But when they started to talk about the quantum of money, I thought, there's no way I can be part of that. So I gave a few ideas and left, thinking I'd never have anything else to do with the group. And then I got a phone call from Jonathan Lomas, this fellow from Canada, who said, no, we really want a small jurisdiction. How much can you afford? And so the contribution from ACT Health is in the 22 million or so that's there, plus in-kind contributions, relatively small. But for me, it's 50% of the research funding that I have in population health. So it's a big commitment from our point of view. And in terms of in-kind, we've tripled what we thought would be given in that way because of the interest and the relevance of the work. So that's something that's been really important. So it's great being a small jurisdiction being included. And all along there's been inequality of influence regardless of that small contribution, which has been very much appreciated. And the whole idea sharing and the embedding research with embedded capacity building has been a crucial component and very positive. And I think, and I've said this before at meetings, that I think there's been a tangible change in the landscape during that period, since 2011 or so, when we had that first conversation in the NHMRC building in Canberra, to now. How much TAPS has been a driver of that, it's hard to quantify, but I think it's definitely been part of that change and a key change agent, at least in those of us that have been involved. And through us, outside the health sector and beyond into government, certainly in the ACT context, it's been like that. There's been a real appreciation and a change of what research can do and how it can be involved in this type of way. So that's been really positive. My one little case study is the Louise story. So Louise works with me. She's an epidemiologist in the Population Health Division in ACT Health. And she was one of the people that's been fortunate to be funded by the centre with a scholarship. So she works part-time on research, but still remains embedded in ACT Health, she's been remarkable, and the support that's come from the centre and beyond the centre for her work has been quite extraordinary. And she essentially, I would suggest to Louise, I'm one of her supervisors, and there's others associated from the centre that are her supervisors. We will suggest something or someone we've heard of through the centre's partnerships, broader partnerships, and she'll immediately email them very cheekily and say, "Oh, would you like to be involved?" And they've all said yes. So now we've got this incredible support network doing dynamic system-based modelling in relation to gestational diabetes. And as impressively, she's actually been able to call on key clinicians throughout the ACT Health workforce and beyond, so well beyond the partnership in the Northern Territory, other parts of New South Wales, and etc. And they've been engaged, and they've seen how this sort of thing can work and be changing in the way that they view this particular issue. It's really quite exciting. Co-production, co-design, co-benefit, mutual respect, all of those things have been mentioned before. That's worked really well. I think in terms of the challenging, I work at light speed and glacial speed every day, sometimes at the same time, and that's a really great thing. Thanks, Diane, for that. I'm going to use it a lot. So that has been challenging. I mean, this has been a slow process. So as I mentioned, that first meeting was in 2011. It's only really, I think, in the last 12 months that we've really seen a huge blossoming of the work from the centre. And that's the reality. It takes time to build up these sort of things. It's a very complex arrangement. Because it was new to NHMRC, and I sit on council, so I know the kind of discussions that go on. I can't talk about all of those, but this was a risk. The previous head of NHMRC was really pushed into this by the politics of the national government of the day around partnerships. Very uncomfortable space for NHMRC. It's hard to measure this stuff. All this stuff that's happened in the last 4 years, how do you measure it? Is it working? Don't know. Where are the papers? I think there was only 5 in the first year or something like that from this big centre. How is the track record progressing for all the major researchers? Billie and Adrian have both sort of touched on that. It's a risk for them as well. It was a risk for us in terms of putting funding into this new concept as well. So as partners, so those things were tricky. I guess the other one, which I'd be honest about, is that the Lone Rangers didn't always have silver bullets. So, we looked to these guys as the experts, and sometimes they actually didn't have the answer. And initially that was disappointing, but then we realised there actually wasn't an answer, so we had to work together, co-production for co-benefit, to find an answer. So, but that was tricky in the start. Yeah, so I'll finish with one thing. This was a slide that Diane Finegood showed in the session the other day about, and this is talking in a different context, but what she was talking about was we can either let things happen or we can make them happen on a continuum, or we can help things happen. And I think the TAPC has been a helper. It's about negotiation, influencing, enabling. It's about diffusion and knowledge transfer, knowledge brokerage. It's not forcing things to happen, and it's not just sitting back and saying, well, that'd be a great thing to happen, but we were not going to be involved with it. So for all those reasons, it's been a terrific thing to be involved with, and I look forward to answering questions. Thank you.
Okay, thank you to all our wonderful speakers, very entertaining. So really I just wanted to end with thanks to our lovely panellists. Thank you all for coming. We genuinely think partnership research has great potential. Yes, of course there's challenges, and I don't think we can emphasise enough the value of relationships, trust and mutual respect, and go forth and let's not make any of Adrian's errors. I feel very pressured. Thank you.